Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The oral examination for all dental procedure begins with a careful inspection of the head and neck for facial asymmetries, developmental abnormalities, and profile deviations. Submandibular and cervical nodes, parotid glands, and temporomandibular joints should be palpated for possible underlying pathology. The intraoral examination begins with the lips and vestibular mucosa. A record should be kept of any abnormal soft tissue attachments. Gland openings are investigated and the salivary flow observed. Palatal and pharyngeal inspection is carried out. Special note should be made of the gag reflex. The lateral border and base of the tongue are carefully examined for evidence of pathology. The level of the lingual attachments are noted and recorded. Structures of the floor of the mouth are very carefully inspected. This is a common site for the development of intraoral carcinoma. The edentulous ridges are inspected for the degree of bone loss, texture, and mobility of the mucosal covering is observed. The occlusion is checked, and the occlusal plane is observed. Malposed teeth which may interfere with appliance insertion are noted. The relationship of the tuberosity to the retromolar pad is important. The degree of vertical and horizontal overjet is noted. Any premature contacts in centric occlusion are noted. Freedom of lateral excursions is examined. Variation between centric relation and centric occlusion is noted, and interferences in excursions at the posterior position observed. The remaining teeth are closely inspected for caries, faulty restorations, and poor contacts. Tooth mobility is checked. A vitality test should be performed on the remaining teeth, particularly those teeth that are prospective abutments, and the result should be recorded. The Burton-type vitalometer is a satisfactory instrument for this procedure. The supporting structures are examined for areas of irritation, pocket formation, or other abnormal conditions. The oral hygiene should be observed at this time. The remaining teeth are cleaned and polished prior to obtaining primary impressions. The alginates are most commonly used for primary impressions, but any suitable elastic material may be employed. An impression tray is selected, inserted, and checked for proper extension and contour. Utility wax can be adapted to the lingual flange area to control the structures in the floor of the mouth and assure accurate recording of the edentulous ridge area. A maxillary tray is selected and inserted. The relationship of the tray to the juncture of the hard and soft palate and the vault is observed. The tray is repositioned following the placement of wax. Very often, the addition of wax is necessary to prevent sagging or loss of the impression material in the posterior vault area. The manufacturer's direction should be followed in handling the impression material. The indicated water-powder ratio must be observed and proper water temperature maintained. Correct mixing is essential. The impression material is placed in the tray in such a manner as to prevent air entrapment. Cool water is applied to the surface of the impression material to slightly retard surface setting and remove surface air. Prior to inserting the tray carrying the impression material, the glandular areas of the posterior palate are swabbed with a cotton sponge. After gelation has occurred, the impression is removed and inspected for accuracy. The mandibular impression is recorded in a similar fashion. The tongue should be elevated during the insertion to record the level of attachment of the lingual frenum and the soft tissue structures in the floor of the mouth. An accurate recording of these areas in the mandibular impression is mandatory. The tooth shade is recorded at this time in the event a temporary prosthesis is required. A suitable occlusal record is made, which will be used in future procedures, primarily in mounting the study casts. A simple wax interocclusal record is generally adequate. However, when an insufficient number of teeth remain, it is necessary to make individual record bases with wax occlusion rims for proper articulation of the study casts.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.